The virus didn't care if you're rich or poor or what color or race you are. It just takes, and it takes life really fast.
Times Square is a ghost town, so that was like surreal to see.
I've never seen New York City like this before.
Our patients felt this immediate isolation and confusion as to what was happening.
It was a helpless time for all the people because we don't know what the virus can do.
I remember the date exactly. It was March 16th, 2020. You can imagine the first thing we felt was fear.
More than 1,300 people sickened in the U.S. At least 39 have died.
Coming to work was definitely something that I feared. I feared going home more so because my family is at home.
We immediately implemented the command center. How are we going to get our patients the care they need? And the staff, how are we going to get them involved to make sure our patients are getting the care they need?
Within 24 hours, we were like, you still have patients. You're going to call them tomorrow, and you're going to do the session over the phone.
So we had a group in charge of making sure that we had the personal protective equipment that was needed so that we could feel safe.
It happened pretty much overnight. PPE, gloves, goggles, face masks. We had to screen everyone who walked in the building, take temperatures.
We did afternoon huddles to check in with the team and looked at what the local, state, and federal government agencies were saying. The information was changing hour to hour, minute to minute, so we had to stay on top of protocols. We had to stay on top of guidelines.
Ryan Health was able to continually provide services. There wasn't a single day where we didn't.
We have faith in the community that they're going to come to us and we're going to help them, and they have to have faith in us also that when I need you, you're going to be there.
Even when the governor shut down New York City, we were here to provide our patients with the compassionate care that we do all the time.
Everyone was in a state of shock. Within the first month, there was an increase in suicidal ideation. While we're all trained in dealing with that, we had been trained to deal with that in person. And so now we had to deal with that remotely, whether on video or phone.
Telemedicine was not just something new for Ryan Health Network, it was also new for our patients. We had patients that were not as technically savvy as others, so we had to enlist family members that were in the home to use their smartphones to do video visits. We definitely, as a team, worked together to make sure that our patients were able to connect to us.
A lot of people presented with trauma because of what was happening, but that wasn't the only concern. There were a lot of protests in New York City.
As we got into the pandemic, obviously there was other issues in the world, and one of the issues was the racism issue in the United States. And so we needed to also take that into consideration as we went forward.
Trying to just get patients a person to talk to that they trusted was important, and we were able to connect with patients on another level.
Shortly into the pandemic, we received a call from the governor's office saying, would you consider being COVID-19 testing site specifically? Every single day, the staff up at Ryan Frederick Douglass, all they would do with COVID-19 testing.
Having that site, that was a huge game changer for this virus that's spreading really rapidly across the community.
We knew that Harlem really needed to have a site where people felt comfortable coming in to get tested.
Every morning, our team would say a little prayer for our safety and the safety of the people that's coming in for the swabbing.
The old Heights Theater on Wadsworth Avenue in Washington Heights. It's now a community health center.
As the pandemic hit, obviously we had ongoing operations, and one of the items that we were working on was Ryan Health Wadsworth. That site is vastly needed in that community. We're really, really proud that we were able to accomplish that.
Our team really grew a lot closer out of need. Support for each other, but then also to support in terms of working with the patients.
All departments got together, from security to nursing, even the doctors.
Come on now, man. During COVID, people are coming into you in the worst times. Some of them haven't been out the house since March. They believe they're risking their lives, stepping out, coming into a center that's packed with people. To them, it is life or death. People's emotions are high.
I spoke to my doctor. My doctor said it's okay. But then my son is getting scared.
My mother's around your age also.
I'm 71.
I got my grandmother, my sister. I have it still here.
Okay.
Especially if you have underlying conditions.
I'm gonna do it.
I think you should.
In early February, we received an email from the federal government asking us to become a direct Moderna vaccination site.
Last year, we were there swabbing at Frederick Douglass, and now this year, we're vaccinating people, so it's coming around in full circle.
As a community health center, we made sure that the limitations of computer literacy or language barriers never played a role. We just wanted to make sure everyone had a fair shot of getting it.
We are honoring our staff for what they've done over the last year. Every single department has stepped up to make sure at Ryan Health we're able to serve our patients and get them the medical care, health care, behavioral health care they need.
It's really heartwarming to see that what you do at work affects the community, and it brings smiles to faces.